This right here is the ascending aorta. This first branch off of the ascending aorta is the brachiocephalic trunk. This is the left common carotid, and this right here is the left subclavian. If I follow the arch of the aorta, it goes down. It's now known as the descending aorta. We have these branches which are between the ribs. They are called intercostals. Inter because it means between, costal meaning ribs, so intercostal arteries, intercostal veins. If we look on the opposite side, this is where the lung is. So this in red is going to be the pulmonary vein. This in blue is going to be the pulmonary artery. So pulmonary vein, pulmonary artery. If I look at the veins up here, this is the superior vena cava. This is the left brachiocephalic vein. This is the left internal jugular, and this is the left external jugular. So again, superior vena cava, left brachiocephalic vein, left internal jugular vein, left external jugular vein. As I move down, this is the abdominal aorta. Now remember, below the diaphragm is going to be abdominal aorta, above the diaphragm or superior to the diaphragm is going to be the thoracic aorta. So this is thoracic aorta, and this down here is abdominal aorta. So in the center here would be the celiac trunk. We have three branches off of the celiac trunk. We have this one which goes up, which would be the left gastric artery. We have this one which goes to the right of the patient, and because it's going to the right toward where the liver would be, because remember the liver would be in here, is going to be the common hepatic artery. And then we have this vessel which would go down and to the left, which would be the splenic. So again, left gastric, common hepatic, and splenic. This vessel right here in red is going inferior to the diaphragm, and because it's going below the diaphragm, and we've heard the word phrenic before, this is called the inferior phrenic artery. So again, inferior phrenic artery. As we move down, we see these holes. We see a hole here, and we see a hole on the other side. These two holes right here are going to represent the gonadal arteries. Again, if it was a male, this would be called the right gonadal artery. If this was a female, this would be called the right ovarian. Again, if it was a male, it would be called right testicular. Female, right ovarian. This is the left renal vein. We follow the vein up, and therefore it's going to the adrenal glands. So we call it the left adrenal vein or the left suprarenal vein. This is still the left renal vein. Here's the left renal artery, again because we know it's going into the kidney. This one's going into the adrenal gland, so this is known as the left adrenal artery, also known as the left suprarenal artery. This vein right here is going directly into the left renal vein, so therefore this is called the left gonadal vein or the left ovarian or left testicular, depending upon the patient. As we follow down, actually I want to stay here, we have celiac trunk, and I would suggest memorizing it in this order. Celiac trunk, just above the left renal vein is going to be superior mesenteric artery, and then we have the inferior mesenteric artery. As we follow that down, we have the right common iliac, right external iliac, right internal iliac. As we move down toward the leg, we're going to pass the inguinal ligament. The right external iliac, once it passes the inguinal ligament, becomes this artery right here. Now this artery right here is going to be running deep. The reason we know it's deep is because we can look right here, and we can see that the muscles were cut and reflected away. So because this is going deep, this is going to be known as the right femoral artery, therefore this is the right femoral vein. So over here, if we pull back just a little bit, we're going to notice that this right here is the right external iliac. It passes the inguinal ligament and it becomes the femoral artery. If we look on the opposite side, we can see that it's superficial. We'll notice sartorius muscle is right here. If you remember from Anatomy 1, sartorius the snake. So this is sartorius the snake, that muscle. It's superficial, and therefore this vein that follows the sartorius muscle, which is superficial, is going to be known as the great saphenous vein. So again, this is called the great saphenous vein.